Good morning, everyone, and welcome to the Multicultural Media Online Forum hosted by New South Wales Health, the New South Wales Multicultural Health Communication Service, and Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and on behalf of all the partners here, we welcome you to our first session of this online forum, and we will be regularly coming on to you here on live on Zoom every Wednesday. We are honored to have the Minister for Multiculturalism, Mark Coure, joining us for the first time, together with the head of COVID-19 Public Health Response Branch, Dr. Jeremy McAnulty. And we will provide COVID-19 updates and answer your questions throughout the session. We will begin first by acknowledging the traditional owners of the land from where we're all meeting from today. We pay respects to elders past and present. And for us here with Dr. Jeremy McAnulty, we acknowledge the traditional custodians of the land, the Camaragal people, and of the Guringai tribe of the Eora Nation. We pay our respects to elders past and present and extend the respect to Aboriginal elders, as well as to multicultural leaders and elders who are represented today. As we have only 30 minutes, we'd like to request if you can please keep your microphones on mute, but please add your questions to the chat and we'll get them answered by Dr. Jeremy McAnulty and also Minister Coure. And if you have additional questions, let us know. You can email us. It is now my pleasure to hand it over to Minister Coure. Welcome, and it's great to have you here, Minister.
Well, good morning, and good morning, everyone. And wonderful to see so many people on this Zoom this morning for something that's going to be regular, something that I want to do, and something that will be regular as Minister for Multiculturalism and Minister for Seniors, of course. Well, I'm going to thank you all for coming, and this is my first ethnic media press conference since becoming Minister for Multiculturalism. And I've engaged with many of you over many years, and I'm looking forward to continuing that relationship. I do want to acknowledge, of course, the traditional custodians of the lands and the waters in which we meet today, and now pay my respects to elders past, present and emerging. I do want to acknowledge representatives from New South Wales Health, of course, Dr. Jeremy McAnulty, and of course, from New South Wales, Multicultural New South Wales as well. For those I haven't met, I'm looking forward to meeting with you and working with you into the future. Media outlets such as yours play such an important role in getting accurate information out to communities really quickly, and which has been so important during the last 2 years and will continue to be important for a while yet. In order to support you in this effort, I'm going to try my best to get to this press conference every week. It's something that I really want to do. I want to keep you informed, and it also, more importantly, make sure that I'm raising these issues that we discussed with the Premier directly and senior cabinet ministers. There's a couple of points, if I can, that I want to raise before we throw to questions, if we can. Firstly, the vaccinations and the booster shots. Look, getting your vaccination booster is really important. I got mine last Monday. It is really important in strengthening your protection against COVID-19. And I got mine last week, as I mentioned. So did the CEO of Multicultural New South Wales, Jesusa, who's on the Zoom today. This is the best way to protect yourself. It's the best way to protect your families and your loved ones moving forward. The second issue I'd like to raise today, of course, is the rapid antigen test supply issues. New South Wales can provide more of a detailed answer in a second, but I want to say a couple of things if I can. Last week, the Premier announced the purchase of 100 million rapid antigen tests for essential public workers and vulnerable communities. I understand many of these are being distributed as we speak, and they're being distributed to priority groups. And I've spoken directly with the Premier about the need to deliver a portion of these rapid antigen tests to multicultural community groups and organisations, and I understand we'll have further information on this in the next day or two. We know how important multicultural organisations are in supporting your communities. You guys are on the ground, and I will continue to advocate on your behalf in the government. The second issue I'd like to raise, and this is where New South Wales Health will no doubt have some further information on this as well, but a couple of other points I'd like to raise, and that is registering your positive rapid antigen tests. Last week, the government, through Service New South Wales, launched an online portal for registering positive rapid antigen tests. And to support this announcement, we've translated a range of services for people in language to explain the process and guide people through registering a positive response. So in help in language, people can call obviously the translating and interpreting services through Service New South Wales, which is a 13 number, which is 131450. And ask them to contact Service New South Wales on 137788 as well. I just want to briefly talk about two other issues. One, of course, is translations, and I've asked Multicultural New South Wales, and I'm working closely with them and other government agencies. And I want to just acknowledge the hard work of Multicultural New South Wales and thank Jesusa for steering this as well. To ensure important health messaging be translated as quickly as possible for multicultural communities. Over the last week, we've translated a range of content posters, online ads, fact sheets, I should say, social media posts focusing on sort of the rapid antigen registration, what to do and where to take a rapid, when to take a rapid test, an action plan for people who are positive, and other related health advice. So. And of course, information on booster shots. So I've also asked Multicultural New South Wales to work on a weekly circular for multicultural communities, which includes link to all the relevant COVID resources in language released that week, and watch this space for further information on this. And I just want to give a plug to Indian Link, who have taken up the campaign as well and done an amazing job in their publications in getting their community to take up the booster shots as well. Other bits and pieces that I'd like to raise, and then we'll open it up to Jeremy. Of course, we're pushing out translated materials targeted to many relevant communities on social media. I understand that translated radio ads are also being played in ethnic radio stations as well. So there is a lot happening in this space, and we'll throw it now to, if I can throw it out to Jeremy McAnulty from New South Wales Health.
Thank you so much, Minister, and it's great to see you here online, and it's great to have those announcements. Dr. Jeremy McAnulty, thank you so much for joining us. It's your first time, and it's great to see you.
Thanks very much, and really thank you, Minister, for those opening remarks, and thanks very much for having me here at this media conference today. And just to echo the Minister's remarks, it's really important that we engage through you to the local communities who are thirsting for information and accurate information on a regular basis. So I'll just give an update on the numbers we've had from overnight for COVID to give you a sense of what's happening. So across New South Wales, we now have 95.2% of people aged 16 years and over who've received their first dose of vaccine, and 93.8% who've received 2 doses as of Monday. Of the children aged 12 to 15 years, 82.2% have received 1 dose and 78.3% have received 2 doses. Of people aged 5 to 11, which has just started, the vaccine programs, already 16.4% have received their first dose of vaccine, which is great news. The number of vaccines is over 14 million, almost 15 million now administered by New South Wales. So we're encouraging anybody who's eligible for a vaccine booster to have one if they haven't had one already. The vaccine boosters are currently available at 4 months and will soon be available at 3 months after your second dose. The booster, we know, is a really important way of protecting against Omicron. The vaccine wanes over time after you've had your second dose. And so getting a booster dose, its very name means it boosts your protection against disease. So getting a booster is really important as we try and live with this Omicron variant. Sadly, we're reporting the deaths of 32 people today. 12 women and 20 men. 3 people were aged in their 40s, 3 people were aged in their 60s, 8 in their 70s, 11 in their 80s, and 7 were in their 90s. Of the 32 people who died, 23 had received at least 2 doses of a COVID vaccine, 1 had received 1 dose, and 8 were not vaccinated. Older age is, of course, a significant risk factor for serious illness and death, and particularly when combined with underlying serious conditions. There were 5 people who died who were under 65 years of age. 3 were vaccinated and 2 were not vaccinated. We'd like to express our sincere condolences to the loved ones and family of the people who've sadly died. There are currently, in terms of hospitalisations, there are currently 2,863 people admitted to hospital who've been diagnosed with COVID, including 217 in intensive care, 66 of whom require ventilation. In terms of test results, there are a total, combining PCR and rapid antigen tests, 32,297 tests notified to 8 o'clock last night. Of those, 12,450 were rapid antigen tests and 19,847 were PCR tests. Of the rapid antigen tests, the 12,450, just over 10,417 were in the previous 17 days. Of the PCR tests, of which there were 19,847, that were positive. They were out of a total test number of 84,974. So look, thanks. We'd like to thank the community for continuing with those COVID-safe behaviours. So if you have symptoms, get tested, and you can do that now with a rapid antigen test. We know that rapid antigen tests are not easily available yet, although the government's making an effort to purchase and procure and distribute those tests, and the private sector is also putting in orders, and they'll become more available in the future. If you can't get a rapid antigen test, you can still go and get a PCR test from one of the many testing clinics around the state. So thanks for coming forward. If you do get any symptoms, have a test, a rapid antigen test, ideally if you can. Make sure that you isolate until you get a negative result. If you've had instructions from New South Wales Health, because you're a case and you're a household member of one of the cases, you need to isolate for 7 days. Please maintain those COVID-safe behaviours of using a mask when indoors, of working from home when you can, of maintaining social distancing between other people. Assume the other person might have COVID, and therefore by maintaining a distance between the two of you, that reduces the risk of you getting infected. Practicing good hygiene, so rubbing, using alcohol-based hand rub or washing your hands thoroughly for 20 seconds on a regular basis is really important. Don't go out, stay at home if you do have any symptoms at all. And importantly, get your vaccine. We know there's a proportion of, even though we've got high vaccine rates in the community, there is still a proportion of people who haven't been vaccinated yet. Some of those just haven't got around to it. So if you haven't got around to it yet, please get your first dose, get your second dose when it's due, and importantly, get your booster dose, because it's, as we said before, so important to give you an elevated level of protection into the future. Thanks very much.
Thank you so much, Dr. McAnulty. And you've tackled the question about rapid antigen tests that they're not available, but Minister Coure, there's some questions here about how to access them and what can they do if they can't get them anywhere? And I guess that's a question for you when you were saying that you're trying to get that available for multicultural communities.
Look, that's a really good question. So the Premier's announced 100 million rapid antigen tests a Sunday ago, and half of those are being distributed to over the next week or two to vulnerable communities firstly, and as we speak this week and last weekend, a lot of those are being distributed to remote Aboriginal communities. So 54,000 of those in roughly 45 communities are being distributed as well in those communities. Look, it is a serious question. We're seeing more supply come through, and we're seeing much more supply come through over the next few weeks. And, you know, it's not easy. You know, I'm asking individuals and communities to be patient. We're making sure that, you know, those kits will be distributed as quickly as possible throughout the community. Chemists are getting them as we speak. I know a number of local chemists in my electorate have finally got supply. We'll see a lot of this. We will see supply increase over the next week or so.
Thank you so much, Minister. Dr. McAnulty, there's a question here by Dr. Bushra Al-Abaidi from the Iraqi Australian University Graduates Forum. The question is, the expectations that school opening will be a super spreader. Can our health system and hospitals cope?
Yeah, look, schools are really important places for children to be. We know there's been a lot of disruption over the last 2 years for children going to school, and it's really important that children have an opportunity for education. Schools are actually a relatively safe place because they're well controlled. The education department and private school sector have put in controls to minimise interaction between children, to cohort children going into playgrounds and so on. So it's a more controlled environment, having kids in school than perhaps out of school in many situations. And we know that children, fortunately, tend not to get as sick as adults, even though they're not vaccinated yet with a full vaccine in the smaller children. We know that they, regardless of vaccine, they tend to do much better and have relatively mild disease and often no symptoms at all. So in terms of the burden on the health system, we are not expecting that the childhood infections will have a big burden on the health system. Nonetheless, it's important that we do all those COVID-safe things to protect our children, including, the things I talked about before, getting vaccinated when they're eligible, getting a second dose when they're eligible, making sure, helping them wear masks and teaching them how to wear masks when at school, teaching them about good hand hygiene and, where at all possible, social distance. It's also important, schools are one place and it's controlled, but while we've got large numbers in the cases, there are things we can do when the child is out of school. Ideally minimising interactions. A lot of the transmission we've seen in the past has been at sleepovers or kind of parties and play dates among children. So there are things parents can do working with their children to minimise those out of schools exposures, which in fact might be as or more important than exposures at the school itself.
Thank you so much, Doctor. Now, a question here is about the RAT testing, and you were talking about this, Minister, about available in-language services. A question here is, how do I report a positive RAT if the system is only in English?
Well, that's a very good question. There is a 13 number through Service New South Wales where you call Service New South Wales and then you explain what language you speak or your family speak at home if you're doing it on behalf of someone else. And then they will translate you to an in-language translating service, which enables you to inform Service New South Wales of a positive rapid antigen test.
Thank you, Minister. I guess the question here from our chat, there's question of elective surgeries are available. We have been waiting heart surgeries, triple bypass and other surgeries who are told to wait. When will these surgeries resume? And I guess that's a question for the government as well as health. So Dr. Jeremy.
Everyone wants to make sure that as many people are protected and have their surgery. So urgent surgeries, always continue. And we just need to plan ahead depending on as the situation emerges. We're hopeful that we'll reach the peak soon in terms of cases, and as cases come down, that will mean there are fewer health staff furloughed and therefore the availability of the health system to do their routine work will be more available into the future, but we just need to wait and see and get over this hump.
Thank you so much.
Can I just add to that if I can, just very quickly. Obviously, the Premier has already announced that, we'll utilise, private hospital capacity where needed, as we did during both the Alpha and the Delta outbreaks. But ensure that, they're extending slightly, obviously, the holiday suspension of non-urgent elective surgery, but we'll get hopefully back to normal very quickly.
Thank you so much, Minister. A question here from Kristen Sota. And the question is, if a person has just recovered from COVID and is eligible for the booster, when should they take it? And this is for a health question for you.
Yeah, so thanks for that question. ATAGI, which is the federal committee that provides advice, are working on some specific advice around this very question because it comes up a lot. What our current interim advice is, wait until you're fully recovered, and typically that will be 4 to 6 weeks after you've recovered from infection before you get your booster. The infection actually provides its own kind of booster to you from reinfection for about a month. So wait for that month before you get your booster. But more formal advice will come out from the ATAGI group hopefully in the coming days or weeks.
Thank you so much, Jeremy. We have a question here about people coming from overseas. Minister, a question here is, my family are coming to visit from overseas. What tests do they need to do? And Jeremy, if you wanted to follow up with any comments, but Minister, what tests and how should people be aware when they're traveling?
Look, that's a really good question. And my brother and his wife and 2 kids came from Dubai recently for Christmas. Look, all travellers must comply with the Australian government entry requirements, as we know, including evidence of a negative COVID-19 PCR test taken within the last 72 hours as the scheduled departure. But upon arrival in New South Wales, fully vaccinated people should go straight to their home or accommodation and obviously take a COVID rapid antigen test as soon as possible. Self-isolate until they receive that negative result. They must take another rapid antigen test, as I'm advised, a few days later, and people who are not fully vaccinated arriving in New South Wales from overseas must continue going to that 14-day mandatory quarantine. And that's the latest advice that I've got, unless Dr. McAnulty has further advice on that.
That's good advice.
Thank you so much. Here's a question from Sandeep. Due to the lack of clear and precise instruction from authorities, communities at large are totally confused as how to handle the present situation. Some feel daily life is to be continued as normal, irrespective of the spread, while some others take it as an almost lockdown situation. What does the government and health authorities suggest as we move forward? Minister, would you like to answer this question?
Well, look, it's a really good question, this. And look, as we know, we all know how tough this pandemic has been for everyone across the state. It's been particularly tough on our multicultural communities, right throughout Southwest, Western Sydney, but right throughout New South Wales. Look, this is, throughout this pandemic, it's been extremely difficult. My job as Minister for Multicultural is in working with Multicultural New South Wales and, of course, the Department of Health to ensure that, we continue to support our multicultural communities without, throughout this pandemic, and ensure that, we're working in a partnership with these organisations, because our community groups, I think, are doing it in a remarkable way, where, what we saw during, what we've seen clearly during the vaccination push last year, multicultural groups, religious leaders certainly led their communities through the vaccination process. And now what we're seeing now is, firstly, New South Wales is one of the most highly vaccinated places on earth. But secondly, we're seeing a lot of our community leaders, our religious leaders, and of course, our multicultural media now ramp up their campaigns. And I mentioned Indian Link before, ramping up their campaigns to ensure that everyone in the community gets that booster shot as quickly as possible.
Thank you, Minister. And Jeremy, is there any other updates or comments you'd like to add to listening to New South Wales Health?
Yeah, look, we've got a great communication team who spend a lot of time, work through the night often, to make sure that the often complex messages are communicated effectively to the communities. But it is very challenging because as the epidemic changes, our advice for what people need to do does change, and that's right, because we need to make sure that we've got the balance right between restrictions and people's liberties, while trying to protect the largest part of the population. So we'll continue to try and make sure that the communication is rapid and effective and translated to those communities needed.
Thank you so much, Jeremy. We want to say that the questions that you're putting in the chat, thank you so much for that. We've got the teams from Multicultural New South Wales and Multicultural Health Communication Service providing some answers as well. So thank you for providing your questions, and to our teams from New South Wales Health, Multicultural New South Wales, and the Multicultural Health Communication Service. I guess one of the questions here is that they're asking, Jeremy, is that people are being told to leave isolation after 7 days if they have no symptoms. However, some are still testing positive on day 10 and 12. What are the risks of allowing people to leave isolation without taking a test?
Yes, so we don't recommend testing after if you're a case and then you've passed, and if you're well, and if you pass those 7 days. Testing, is not a black and white thing. It's open to, it needs to be interpreted carefully, and sometimes you can have remnant virus, even though it's not infectious, that can be found by some of the tests. So the testing just often confuses the situation, and so we don't recommend it. We do recommend that people take care in the in the period 3 days after they've been released to that 7 days, even if they're well, to avoid going to high-risk settings and, hospitals, corrective services, aged care facilities, big gatherings with, particularly if there are vulnerable elderly people there, as an extra precaution. But again, it's trying to get that balance right to allow people to get back to work and freedom and so on with what the risk is. And we believe that 7 days plus the 3 days of extra precautions is the correct balance.
Thank you so much. A question here, and I guess I'll toss this to you, Minister. Again, regarding the rat test. From the 24th of January, eligible Commonwealth concession card holders can access up to 10 free rat tests over a 3-month period from participating community pharmacies. The question is, where can they find a list of participating community pharmacies?
Look, that's a very, very good question, and I might pass that to New South Wales Health if I can. I know during the pandemic, I did check. There is a website of suppliers and community pharmacists, but I might throw that back to New South Wales Health. They might have a better answer than me.
Unfortunately, I don't. We'll have to get back to you with that information. Presumably, we can post that.
Yes. The question, I guess, is how do rat tests if they can't buy anywhere? And that was answered is to get to your local pharmacy or supermarket, and if you can visit your COVID-19 testing clinic and get a BCR. I guess that's the best answer we can provide for now.
We might also, if we can, sorry to interrupt, we might also follow up that with the Commonwealth and get back to Multicultural Media.
Thank you so much, Minister, and that's correct. We will get all that information for you, and hopefully in the next coming sessions, we will be able to provide those answers. A question here is from Nabi El-Nashar, again, about the elective surgery. How does the government define elective surgery? We've seen a patient with open hernia with two 100% blocked arteries and one of 80% blockage turned away because these have been classified as elective surgery. I'm sorry to say it's not my area of expertise, so we'll have to defer that one and get back to you. But I know there is a process. There is definitions. There are various categories of people who need urgent surgery or semi-urgent surgery and then elective. But I'm sorry, we'll have to get back to you on that one. Thank you so much, Jeremy. And what we will try to do is get all your questions and try to get them some answers for you. Please email them to us as well. We have a question here is, they've read that some communities have read that WHO don't support vaccinations for those under 12. Why are we pushing it?
So my understanding is, yes, it is supported. And I mentioned it before, we've got national expert groups who look very carefully at the role of vaccine, as do international recognised agencies such as US FDA and the UK and European agencies. And we have our own independent Australian assessment processes through the Therapeutic Goods Administration and ATAGI, which is an expert group that advises independently government about what's the most effective use of medicines, including vaccines. And those groups have said, based on the evidence, that vaccinating children is very important for protecting against COVID. But vaccination protects not only the person themselves, and I mentioned before that children typically get very mild disease, but some children, a minority, can get severe disease. We do see children who, particularly if they've got underlying medical conditions, can get severe disease and end up in hospital. So the vaccine protects them, but it also protects it reduces the risk that the virus will be transmitted among children and also to their families and vulnerable relatives. You know, lots of children have grandparents who are vulnerable. So it's both a herd immunity, if you like, as well as a protection of the child themselves.
Thank you so much for that. Minister, a question here from the community. Why is hospitality not included in the critical workers list? Many restaurants can't stay open with all the close contacts.
Yeah, look, that's a very good question, actually. And I heard Paul Signorelli interviewed on 2GB this morning. Paul Signorelli owns Dalton House in the city and in Sylvania. This is something that I will be raising with the government and including, of course, the Treasurer, Matt Keane, and the Minister for Industry, Stuart Ayres, today. It is, I think, a very good question, but it is something that I will take on notice, and I will follow this up with the relevant ministers today.
Thank you so much, Minister. A question here. Jeremy, do you think we have hit the peak of the Omicron wave?
I hope so. We don't know yet. The indications are that we are likely to around now. Sometimes it's only in retrospect we can tell, but we're hoping that we should start to see a decline soon. So we're monitoring as best we can. Unfortunately, the laboratory, because we know that not everyone is coming forward for testing. We don't have a clearer picture as we would like, but we are able to monitor other indicators such as hospitalizations and so on. So we think we're probably around the peak, but we don't know for sure.
Minister, would you like to comment on how, in terms of what the community should be just remembering in terms of the rules and regulations?
Yeah, look, there's a couple of points I want to raise if I can, and that is just making sure that when your kids, if you've got kids, meet the criteria, that they get their vaccination as quickly as possible, particularly as, of course, we're going into another school year. Making sure that, your vaccination or your booster shot is kept up to date. So if you meet the eligibility criteria and of course, are in a position to get a booster shot, make sure that you get that booster shot as quickly as possible. Particularly as that eligibility criteria has been reduced in terms of the waiting period. We want to make sure that our communities, particularly our multicultural communities, lead by example. We have some of the best vaccination rates anywhere in the world, and we want to make sure that our booster shots keep up as well. If there's a couple of points out of this media conference, and that is today, your community, ensure that your community gets vaccinated, follows the health advice, but of course, ensure that they get the booster shot as well.
Thank you so much, Minister. A question here about the booster. How can we encourage people to take the booster when the death numbers tell us 29 out of 36 dead were vaccinated and 4 of them had the booster even? So this is a question from Hiba. I guess a question for you, Jeremy.
Yeah, thanks for the question. We know that as the population increases in its vaccination, unfortunately we'll see breakthrough infections in some people, but we do know that in analysis, the people who have died or end up in intensive care or with severe disease are much more likely not to be vaccinated. So vaccination provides a very good protection against getting severe disease and from death. Now, we do know that people with COVID and increasingly a higher proportion of the population have been infected. Many of us now know multiple people who've had COVID. But people, particularly if they're vaccinated, do very well generally. The people we see dying tend to be older, so older age, having underlying medical conditions increases your risk. And we do know that the booster shot reduces that risk, but doesn't eliminate it. So that's why we need to do all those other things to remain COVID safe.
Thank you so much. And just a message here from Anna Breen, and she says, good morning. Regarding the RAT and PCR testing, we're getting requests from vulnerable communities as to how housebound community members can get tested at home. And I think that the government and health are working towards that. So I guess we're running out of time. We want to thank Minister Coure, who's allowed us to go over time. But Minister, would you like to give some final comments and messages to the community?
Yeah, look, thank you so much. And firstly, thank you to all of the media that's here today. And this is going to be regular. It's something that I want to do on a regular basis personally as well. I want to thank New South Wales Health and of course Multicultural New South Wales as well. Look, throughout this pandemic, the government has really engaged closely with our multicultural communities right across the state. And these groups have really been fundamental, as I mentioned before, to the government's response. And frankly, we could not have done it without them. And since June of last year, New South Wales government has allocated just over $54 million to support vulnerable people, multicultural communities experiencing hardship during this pandemic. And this funding is ongoing and it's still being used to support community groups right across the state. You know, $38 million in funding to over 750 organisations to help vulnerable communities across 12 grant programs. And this includes, you know, really 150 grassroots organisations as we allocate money to ensure that, you know, information is translated you know, public health information communication is translated in multicultural media. Money for, of course, you know, peak bodies, religious groups, multicultural groups to ensure well-being, to ensure food hampers, ensuring help in any way, shape or form. So there is a lot of, there are many programs out there that we're working towards and we will continue working towards to ensure that, you know, all our community groups are helped as well. I must also give a plug. Multicultural New South Wales has in particular participated in 5,600 individual engagements with ministers, religious leaders, community groups, peak bodies, and so forth. And the agency has held over 100 forums to hear and understand the community needs. So today, of course, you know, these forums have been very important to help inform and how best to support multicultural communities throughout the pandemic. So today, of course, if we haven't got to your questions, all of your questions are really important. If there's anything that I can do or Multicultural New South Wales can do or New South Wales Health for that matter can do, please let me know. We're more than happy to answer these questions offline.
Thank you so much, Minister. It's been great to have you here and we'll see you again next week. But Dr. McAnulty, any last words?
Oh, look, again, thanks for the opportunity. You do such an important job getting that communication out to the communities. So I guess just, you know, we've said it a few times, but getting your boosters, getting your first shot if you haven't had it, getting your children booked in for vaccine, maintaining, you know, get a test if you've got any symptoms at all, stay at home if you've got symptoms until you get a negative test, and practice those good safe behaviours like hand washing, social distancing. And thanks for everyone for their hard work through this pandemic, which is now 2 years old.
Thank you so much, Dr. McAnulty and Minister Coure. I want to thank you all for joining us here at the Multicultural Media Online Forum. And this is our first session, but we'll be back again next week and we'll be providing all updates and questions. New South Wales Health, Multicultural New South Wales, and the Multicultural Health Communication Service are so grateful for you always delivering and helping disseminate the messages, health messages on COVID-19 to the communities. You are essential in this journey for COVID and making sure that the people are informed. We're holding this media online forum every week, as I said, and the recording of these briefings are available on the New South Wales Multicultural Health Communication Service website. I'm Jesusa Helaratne from the Multicultural Health Communication Service. On behalf of New South Wales Health and the Multicultural New South Wales, we thank you again. Please be kind to one another. Take care. Stay safe.